Distinguished guests, ladies and gentlemen, please rise and welcome our guest of honor, the Right Honorable Prime Minister of the Republic of Rwanda. Please join me and welcome him. Please be seated. Right Honorable Prime Minister, I'm Jean-Pierre Nyemazi. I'm honored to be your MC for this session. Guests of honor, we welcome you to the first ever WHO Africa Health Forum that's going to be taking place at Kigali Convention Center today on 27th and tomorrow on 28th of June 2017. Guests of honor, in terms of health burden, diseases, morbidity, and mortality, Africa takes a big share. So having African health leaders coming from diverse backgrounds, government officials, private and business owners, civil society organizations, philanthropists, together with our international partners, gives a great opportunity as Africa is gearing towards the attainment of the Sustainable Development Goals. Guests of honor, in this forum, important issues will be discussed. There will be in total about 5 sessions, including health financing, where important speakers and different experts from the academia, from the government, from the civil society and the private sector.
Partners, distinguished guests, welcome to His Excellency President Paul Kagame and to the people of Rwanda for having welcomed our holding this meeting in this beautiful city. The hospitality of the Rwandan people has not stopped since our arrival here, proving to us that Kigali was an excellent choice. We have other reasons for having us to come here and for the decision-making table. There's a Chinese saying, "May you live in interesting times." These are indeed interesting times. This forum takes place against the backdrop of a shifting global geopolitical landscape which will have major impact on international funding for development. It takes place also as we welcome the appointment of the first African WHO Director General, Dr. Tedros Adhanom Ghebreyesus, who intends to champion increased investment and public-private partnerships for health. At the same time, the reform of the African Union, led by President Kagame, places great emphasis on countries investing more in their own development. And the private sector has recognized health as a sector with good returns of investment and is coming forward to contribute and work with governments towards universal health coverage. Youthful population that refuses to be left behind despite low incomes make for exciting opportunities. At the same time, have reached and share information and coordinate closely with partners on actions to stop this outbreak. And I expect within the next few days with the DRC Health Minister to declare the outbreak over. Your Excellency, dear partners and colleagues, we have to make the best use of immunization, one of the most effective public health tools for the health of the children of the African region. While national immunization coverage rates are high in many countries, 1 in 5 children still does not have access to all the vaccines that they need. And inequities persist with major gaps in coverage between children from the richest and the poorest households, and between children whose mothers have different levels of education. African heads of state acknowledge that greater efforts are needed by endorsing the Addis Declaration on Immunization, which we often call the ADI, during the African Union Summit in January this year. We'll be launching a roadmap at this meeting developed with country governments, WHO, the African Union Commission, and immunization partners to guide the implementation of the ADI. Stronger health systems are essential to ensuring public health security as well as assuring access to services for health promotion and prevention as well as treatment. UHC is about the effective delivery of essential health and related services with improved coverage and equitable access and minimal financial barriers. Low, middle, and upper income countries continue to grapple with equitable access to healthcare. We are seeing this right now, even in the wealthiest nations in the world. And those of you who are watching CNN overnight will know healthcare. This is not acceptable. For stronger health systems and to ensure health security and bring better access to health services, countries need to strive to reach the minimum $80 per capita expenditure recommended by WHO. WHO is actively supporting countries to improve coverage and monitoring of financial protection, especially for the most vulnerable, through strengthening financing strategies as well as legal and policy instruments for health insurance that harness and manage domestic revenues for health. And governments also have the opportunity to partner with and leverage the resources of the private sector. This forum aims to ensure that health interventions are focused beyond the health sector and that we encourage new partnerships through effective engagement in stronger intersectoral action towards a common goal, better development and better health for Africa. We in the health development community will need to learn new, innovative ways of working to reap the benefits of sectoral policies that promote health while reciprocally contributing to other sectors' outcomes. As the head of WHO in the African region, I am determined to create opportunities for effective engagement. For instance, in December, we held our first forum on strengthening health systems for UHC and the Sustainable Development Goals. This generated an action framework providing member states with a menu of options to tailor their efforts towards attaining UHC and contributing to the SDG 3. Our flagship UHC program, developed to accelerate our efforts in the region, aims to provide support to countries to realize tangible and sustainable improvements in their national health systems. This includes leveraging information technology for health and universal health coverage as more and more countries adopt e-health and digital applications as part of public health interventions to progressively transform their health systems and healthcare. And so I am so pleased that e-health will be discussed in detail at the first side event this afternoon with our partner, the International Telecommunications Union. I convened this inaugural WHO Africa Health Forum as a further opportunity to gather some of Africa's best, our best and key thought leaders, policymakers, and bright young people to spark new thinking, new partnerships, and new opportunities for better health action and better health outcomes. We in WHO will intensify our advocacy to ensure that the SDGs and universal health coverage remain at the top of the political and development agenda, and that adequate domestic and external resources are mobilized for health. Ladies and gentlemen, I'd like to conclude by leaving you with a story about two young girls and equity, which I am passionate about. The phrase, leaving no one behind, is central to the SDGs and must be our constant inspiration. The first girl lives in a suburb in a big city, possibly Nairobi, Dakar, or Johannesburg. Her family has health insurance, and she can access decent health care when she needs it. She attends a good school and has the prospects of a future which includes a good job or even starting her own business. She has a smartphone and can access information from all over the world for school and for fun. The second girl lives in a high-density area or slum. When she is lucky, she has one good meal a day, and and she stays away from school when she menstruates because she doesn't have sanitary towels. If she needs to go to a clinic or hospital, the family has to find the money to pay. Otherwise, she simply has to hope to get better. She has a good chance of falling pregnant before completing her secondary education or even being married off early. These differences are the stark reality faced in our countries every day. However, we can, with relevant health policies and targeted actions, work to ensure that these girls both have access to good preventive and curative health services despite their very different and unequal life circumstances. Through UHC, we can contribute to reducing poverty in countries so that future generations can have similar chances in life. Ladies and gentlemen, this is our common goal for Africa and my call to action. We will get there with member states leading and taking stewardship actions at the highest levels, providing the domestic funding to shift health systems towards universal health coverage, and working with the private sector and civil society. With partners and donors maintaining their support and finding innovative ways despite competing priorities, and especially with our youth beside us, taking part in policy setting and decision making. I thank you all for having joined us at this inaugural Africa Health Forum. I look forward to lively debates and exciting new partnerships. Each and every one of us here can play a part in ensuring healthy lives. Whatever we do best, let's bring our skills together to make people healthier in the African region and to achieve a prosperous, sustainable future for all. I thank you very much for your attention.
Thank you very much, Honorable Dr. Moeti, for your remarks. Guests of honor, allow me now to invite Honorable Minister of Health of the Republic of Rwanda, Dr. Diane Gashumba, for her remarks. Thank you.
Right Honorable Prime Minister, WHO Regional Director, Honorable Ministers, distinguished guests, good morning. Allow me to take this opportunity to thank the WHO leadership for having chosen Rwanda to host the first WHO Africa Health Forum and for their contribution to the improvement of the African health system as it stands now. Thank you, dear sisters and brothers from all over Africa who responded to this invitation and came to contribute to this noble theme of this first Africa Health Forum. Welcome to Rwanda. On behalf of the Rwandan Ministry of Health, may I voice our full commitment to collaborating with all of you. Here in this forum, we will share our respective strengths and explore steps toward opportunities we can to overcome all our shared concerns. Rwanda's experiences and perspectives is a testimony that when politics are people-centered and the notions of unity, equality, and commitment are placed at the center of the country's development, the transformation of lives of people is doable. Right Honorable Prime Minister, WHO Regional Director, distinguished guests, I wish to recognize and thank the organizers of this Africa Health Forum. I thank WHO leadership and staff, the Ministry of Health, RBC staff, all government institutions from other sectors, and the private sector for the incredible collaboration and tireless effort put into the preparation of this important event. This inauguration of the forum, the Health Forum, evidences how, if we all join hands together, we shall defeat all the health challenges in our countries, on our continent, and throughout the world. I thank you for your kind attention, and with this, allow me to invite Right Honorable Prime Minister of the Republic of Rwanda to give his remarks. Thank you very much.
Honorable ministers here present, guest ministers, host ministers, the regional director of WHO Africa, members of the diplomatic corps and heads of international agencies, senior government officials, distinguished invited guests, ladies and gentlemen. A very good morning to you all. On behalf of His Excellency Paul Kagame, the President of the Republic of Rwanda, it is my great pleasure to join you today at this official opening of the first WHO Africa Health Forum that is taking place here in Kigali Convention Center. The government of Rwanda wishes to extend its warmly welcome to all our esteemed guests. Soyez tous les bienvenus au Rwanda. Please feel most welcome to Kigali. We trust that alongside of your two-day forum, you will have an opportunity to visit other beautiful and touristic parts of our country and enjoy the Rwandan traditional hospitality. The government of Rwanda most sincerely thanks WHO for having chosen Rwanda to host this important Africa Health Forum. This is yet another proof that WHO recognizes Rwanda's efforts aiming at improving our health standards and providing an efficient and productive workforce in this sector. Excellencies, distinguished guests, the theme of this Kigali Africa Health Forum is putting people first, the road to universal health coverage in Africa. This theme is very, very important. It is a good opportunity to advise African countries, African governments, on how to efficiently improve health security, progress towards equity and universal health coverage, and the unfinished agenda of communicable diseases. In so doing, this forum will be in line with the implementation of one of the 17 Sustainable Development Goals, SDG 3, that concerns good health and well-being. This goal calls on countries to ensure healthy lives and promote well-being for all at all ages. The road to universal health coverage in Africa is also number one of the priorities of Dr. Tedros Adhanom Ghebreyesus, the newly elected Director General of WHO, the ever African elected Director General of WHO. He pointed out, I quote, "All roads should lead to universal health coverage. I will not rest until we have healthy lives for all Africans is also one of the main targets of the Agenda 2063, the Africa we want. In this agenda, African people will have a high standard of living and quality of life, sound health and well-being. Being healthy, as His Excellency President Paul Kagame, the President of the Republic of Rwanda, once said, I quote, "Being healthy is the basis for all socio-economic development, and without it, nothing can work." End of quote. For this reason, African countries must work together and learn from each other through sharing experiences. This will certainly translate the 2063 dream of good health and well-being into reality. Coming back to the theme of this forum, putting people first, the road to universal health coverage in Africa, I would like to share with you what Rwanda has so far achieved. Since 1994, after the genocide against the Tutsi in Rwanda, the health system undertook several reforms. Rwanda set up innovative solutions, such as Ubudehe, homegrown solution, one of them, which assigns health support to our people according to their socio-economic status. Our country is now advancing towards universal health coverage for the basic health needs for our people. There are some other examples of innovations in the health sector in Rwanda. Another example is Mutuelle de Santé, our community-based health insurance scheme, as well as the government subsidization of healthcare services, such as malaria treatment. These culminating innovative efforts are helping us to ensure equitable access to health services throughout the country for our population. But the population has to contribute, and they do it. Rwanda achieved the Health Millennium Development Goals, gaining recognition on a global scale for this achievement, and we continue to push forward to achieve the health sector sustainable development goals and other goals of SDGs. These efforts have now made Rwanda as one of the few African countries with more than 90% coverage for immunization and access to critical health services, including TB treatment and access to ARVs for HIV patients. We are confident and very highly committed to share this exciting experience in health sector services with all of our sisters and brothers from Africa. Mutuelle de Santé, community-based health insurance scheme, was established in Rwanda in 2004 as a national policy to meet the needs of Rwandans who did not have other health insurance schemes. Mutuelle de Santé, as of now, covers 84.6% of the entire Rwandan population. or the part of health insurance coverage. This is from the foremost sector, public sector, and the private foremost sector. Using these achievements as a foundation, we are currently building upon these national comprehensive frameworks, looking forward to the next 30 years. Actually, we are now developing our Vision 2050. And we are preparing the third Economy Development and Poverty Reduction Strategy, EDPRS 3, both of which will aim at transforming our country into an upper middle income country by 2035 and into a high income country by 2050. As far as the universal health coverage is concerned, the sustainable partnership with the World Health Organization, WHO, and other esteemed partners will continue to play a key role in a policy design, financial resource mobilization, and programs implementation. Honorable Ministers, the Regional Director of WHO Africa, Excellencies, distinguished guests, ladies and gentlemen. I would also like to call upon our fellow African countries to set up strategies that will help them and all of us to implement the resolutions from this forum. I also request all health stakeholders in Africa and beyond to support Africa's efforts in this regard and to ensure that such efforts are aligned to national aspirations and priorities. And finally, I call upon the private sector, the vibrant private sector of Africa. We want to invest more and more in the health sector. In conclusion, I once again wish to thank WHO and its partners, our partners, for having successfully organized this forum and for having selected Rwanda as a host country. I also thank all participants to this health forum. Rwanda is looking forward to receiving and implementing the recommendations from your deliberations. With these remarks, Excellencies, distinguished guests, ladies and gentlemen, I am now pleased to, on behalf of His Excellency Paul Kagame, the President of the Republic of Rwanda, to declare the first WHO Africa Health Forum that is taking place here in Kigali officially open. Thank you for your attention. God bless you.
Thank you very much, our guest of honor, for your inspiring and very thoughtful message. No doubt it has set the tone and the direction that this forum and the next ones are going to follow. We have well noted the aspirations and as well the targets and the core of action that also has come out from your address. Now, guest of honor, we are towards the end of our opening session, and I would like to invite our guest of honor, Honorable Minister of Health, the Regional Director, for a group photo. They will be as well joined by honorable ministers present, guests and hosts, heads of delegation for African countries present here, and the executive directors of the WHO Africa region. The ushers and protocol will help us on this endeavor. Thank you very much. Again, please join me to thank the Right Honorable Prime Minister for coming to open this forum. Thank you. Thank you. So the ministers, heads of delegation sitting on the first and second row in the leather seats, please accompany the guest of honor for a group photo. And the others will wait for a few minutes. There's some important communications we want to provide. Thank you very much. So, Excellency, the ambassadors, distinguished guests, ladies and gentlemen, key important communication.